We are doing Strengthening West Virginia's Behavioral Health Workforce for the Future. I have listened to these two ladies before. They do a great job. So I will introduce to you Carolyn Canini. She's the Director of Behavioral Health Programs at West Virginia Higher Education Policy Commission. She joined the Higher Education Policy Commission in 2019 as the first director of the Behavioral Health Programs. In her role, she works to promote educational initiatives to increase the state's behavioral health workers. Rebecca Roth is also a director of but she's with the Office of Policy, Planning and Research, West Virginia Bureau of Behavioral Health. Rebecca has more than 20 years of experience in nonprofit, state, and federal government sectors in West Virginia, during which time she has focused on strengthening collaborations, leveraging resources, writing, and facilitation. Welcome, ladies, and please continue.
Hi, good afternoon, everyone. Thanks for having us. I'm going to try to share my screen. Terri, I think I might need your help on this.
And we're going to ask for Brittany. Did you share? You shared it with Brittany, so she'll be able to share it.
I'm seeing a message, host disabled.
Try it again, we just enabled it.
Thank you. Just take me a minute here to get settled. Terri, are you getting my messy desk? Or are you getting just the slides?
I'm getting the slide and I'm seeing you on the side, but I'm just seeing pretty much your face and a little bit around you.
Not the messy desk.
No messy desk.
No messy desktop.
No, but your slides are up.
Okay, great. Good afternoon. My name is Rebecca Roth, and like Terri said, I'm the Director for the Office of Policy Planning and Research for the West Virginia Bureau for Behavioral Health at DHHR. It is my pleasure to be joining Carolyn Canini from the West Virginia Higher Education Policy Commission to discuss the topic of behavioral health workforce with you today. Thank you for including us as part of this action-oriented dialogue for big solutions. I'd like to acknowledge, at the risk of sounding like a voiceover for a movie trailer, that it's in a world that is changing under our feet that we're having this conversation today. As West Virginians, both national and state-specific experiences are affecting us. The COVID-19 pandemic, an historic election, This month, an ongoing polysubstance epidemic, mental health concerns, and a foster care crisis, the Black Lives Matter and racial equity movement. Each of these are huge boulders that have been dropped in the water in which we swim. Where we may have anticipated ripples, we are grappling with waves. The landscape is changing rapidly, with many priorities battling for our collective attention in the public sphere as well as our private lives. What does this mean for a discussion of workforce and behavioral health workforce in particular? Addressing all of these issues and the reactions to all of these issues requires a strong behavioral health workforce. You may remember from your children's childhoods or your own that Mr. Rogers reminded children in scary times to look for the helpers. The behavioral health workforce, people whose jobs are focused on the prevention, intervention, treatment, and recovery of mental illness and substance use disorders, includes many who are often referred to as being in the helping professions. The helpers in our state and communities need help too. Helpers in behavioral health, like all essential workers, from grocery store staff to parents, are spending long hours doing hard work, addressing and responding to the challenges we face. So let's talk about our learning objectives today. We're going to, 1, discuss how increasing need and decreasing capacity has led to partnerships in addressing behavioral health workforce across the career continuum. 2, identify existing partnerships and ongoing activities that offer opportunities to utilize best practices or become involved in current initiatives. And will 3, describe West Virginia's statewide ecosystem of substance use disorder and mental health care and who and how to contact to build on homegrown and national expertise. Let's get a little meta for a second. The very first example of existing partnerships and ongoing activities that I want to highlight is the ongoing partnership between the Bureau for Behavioral Health, the place within the state agency where I am, and the West Virginia Higher Education Policy Commission, where Carolyn Canini is. She and I have regular calls to share information, troubleshoot, and support and amplify each other's efforts, whether it's disseminating information to broader audiences, learning together about successful programs in other states, presenting together, or serving on committees. I appreciate her and her work very much, and as I explain where I am located in state government, you'll get a sense of why. So I've put up here the vision, the West Virginia Department of Health and Human Resources, Bureau for Behavioral Health, champions West Virginians' wellness, resilience, and recovery. Our mission, to serve the people of West Virginia by working with strategic partners to advance access and quality of statewide behavioral health to empower each West Virginian to reach their potential, and values. Value the lived experience of stakeholders, families, and communities. We believe in connection and hope. I want to encourage and challenge you to think about the idea that the bottom line for today is that whether you're talking about small communities or people with a mental illness or substance use disorder, that recovery happens. This is also a tagline from the federal agency SAMHSA, by the way, more about them later. I also want to encourage and challenge you to consider what can happen when we make the most of West Virginia's resources by building scaffolding and surge capacity that is connected to infrastructure. Let's level set about the workforce with a brief discussion of background and a pop quiz. West Virginia is the only state in the nation with a declining population. West Virginia is the state with the lowest workforce participation rate. West Virginia has the least proportion of college graduates. West Virginia has the lowest workforce participation rate for women. If you chose true for all of these, you are correct. This is the background for any discussion of workforce, including behavioral health in West Virginia. We also are an older population. We're dealing with what nationally has been referred to as the gray tsunami, when folks close to retirement are currently working for low pay in a field that needs to grow significantly to meet expanding urgent needs. This is challenging work, no more so than now, when stress, anxiety, depression, substance use, isolation, compassion, fatigue, and burnout are on the rise, not to mention that many households are dealing with instability of housing, work, and food. So addressing workforce need will require West Virginia to improve the state's ability to monitor and analyze the outcome of its investments in what we call the continuum of care: prevention, intervention, treatment, and recovery support, because what investments in these programs do not involve staff? So let's go through the continuum of care and how we connect infrastructure to building surge capacity and building out from that infrastructure to meet people's needs. So many people are very interested in prevention using this reason. If prevention is effective, the need for a larger treatment workforce should decrease, right? Our bureau, the Bureau for Behavioral Health, which I may sometimes call BBH, invests in a prevention infrastructure of 6 regional prevention lead organizations. These 6 organizations promote positive mental health and substance use prevention for adults and youth through evidence-based programs, public awareness campaigns, toolkits, and support county prevention coalitions focused on each of West Virginia's 55 counties. BBH has strategically used federal grant funding to add staff in the field to the existing prevention lead organization infrastructure to, for example, address the increased concerns about suicide and overdose. BBH began piloting expanded school mental health 4 years ago and is now working towards state coverage. In September, the state brought together state and national experts around prevention of multiple types with a prevention summit that brought together more than 500 online attendees. We do more together, building on each other's work, being workforce extenders rather than duplicators, making the most of all our contributions. Strengthening the behavioral health workforce is central to capacity when it comes to smaller communities in particular. Unfortunately, our Bureau has made announcements of funding availability, what we call AFAs, to address particular treatment needs and not gotten any applications, particularly in rural, under-resourced regions and regions with insufficient workforce. And since I have your attention on this page of BBH's website, I'll take the opportunity to encourage you to Google BBHWV for more information on opportunities for funding, or to submit an unsolicited grant, please see our website. We're in the process of updating the website so that it will become more useful and user-friendly. So what do we do about the treatment capacity we need to build? We've worked with partners to support federal funding to expand treatment capacity. And the data piece on an earlier slide will help us evaluate the effectiveness of our efforts. Inevitably, when we're talking about workforce, making the most of what we have and drawing on a larger potential workforce, the conversation turns to telehealth. This is the same with behavioral health. Telehealth is one piece of the federally funded needs assessment on the previous slide. BBH has also built onto the infrastructure of call lines when it comes to the surge capacity we have needed during COVID-19. One example is the Emotional Strength Line, which federal FEMA crisis counseling funded has supported starting up in order to meet the needs during a time of social distancing and masking. As you are aware, the state has received major funding through the federal government, the SAMHSA federal agency I spoke of earlier, the strategic targeted response to opioid use disorder, and the SOAR grant, the State Opioid Response Grant from SAMHSA. And a big piece of this federal funding is to make active referrals, sometimes called warm referrals. And so under STR, West Virginia funded specialized peer workers with lived experience to walk through recovery steps with West Virginians seeking support in their recovery, with specializations that included justice involvement, pregnant and postpartum women, and peer workers who can support people after an overdose. We saw in the 2016 West Virginia overdose fatality analysis that more than ever, healthcare needs to meet people where they are. So the scaffolding that has been built to connect pieces of service delivery extends out from existing treatment services. For example, also with quick response teams to follow up with people who have experienced non-fatal overdose and are vulnerable to another overdose. Recovery support services, this is the next piece of the continuum of care, are critical to keep people in recovery. BBH has supported recent legislation and rulemaking to provide infrastructure for the recovery housing sector in West Virginia, building on the national models that support the unique needs of people in recovery and communities. BBH is providing support to the West Virginia state affiliate of the National Alliance for Recovery Residences. In September, we partnered on the state's first recovery housing conference to share ideas for sustainability of residences using best practices to support people in recovery and their communities. And I realized that you had an earlier session that was focused on recovery, but I think it never hurts to underline some of these critical things. West Virginia has important programs to recruit and retain much needed health professionals to address shortages and maldistribution, unfortunately common to rural healthcare. Unlike health professionals like dentists or physicians, however, social workers, counselors, psychologists, individuals with master's or sometimes doctorate degrees will not, when they are finished with lengthy training, expect to receive similar pay. West Virginia Higher Education Policy Commission and DHHR are working together to fill in the portfolio of loan repayment and other programs specific to supporting the existing behavioral health workforce, especially therapists and counselors. The statewide therapist loan repayment project was unique because it was a collaborative effort focused on individuals who were new to the behavioral health workforce and gave priority to candidates themselves in recovery. By the end of 2020, there will be 22 individuals who this funding will be supporting in their new careers. And by the way, this program did not remove all of the student debt for any of these individuals. I think these pieces from people who applied to this program are so powerful that I hope you'll indulge me and let me read them to you. I am a person in long-term recovery. I have not had a mood or mind-altering substance since August of 2012. I work every day to maintain my recovery and rebuild my life. The financial help with my student loan would be beneficial in relieving debt and providing me with financial freedom to continue moving forward in my life, and one day being able to purchase my own home and provide for my grandson, who I was able to adopt after 7 months in court due to my background. Society has given me the opportunity to have the life I never imagined possible. I take great pride in the work that I contribute to. This is another individual, supporting vulnerable individuals and families in their personal rebuilding. I have come to appreciate Huntington again, recognizing that we still project hope and promise. I take great pride in every individual that I assist in recovery, knowing that they are a part of West Virginia's story of awakening, rebirth, and growth. So in addition to those type of workforce, behavioral health workforce specific initiatives to bring more people into the workforce, we're also working on quality assurance initiatives, which build the quality of our workforce overall. And this is a piece that we have worked on. I don't know how I suddenly have begun to color on my slides. So apologies for that. We are also building out our workforce for particular populations, reaching particular populations such as children in both mental health and substance use disorder, including a new children's crisis line. And the regional youth service centers are building capacity in West Virginia, particularly around substance use among youth. We are strengthening our workforce through training and professional development infrastructure. And so I just wanted to put some of the key pieces of that infrastructure here, focusing on existing conferences where folks are getting continuing education, and also some of the work that we've been involved with and supported related to curriculum. Pretty much anytime we become aware of an opportunity to benefit the behavioral health workforce, we try to put our hat into the ring to get West Virginia national resources. Back in 2017, West Virginia Bureau for Behavioral Health, as West Virginia's single service agency, was one of 4 states in the US to receive funding from SAMHSA, the Substance Abuse and Mental Health Services Administration, and NADAC, the National Association of Addiction Professionals, to host a behavioral health workforce forum. The goal of the forum was to reach out to college and university students to build awareness and provide education about the benefits and opportunities available in the substance use and mental health disorder professions, with the goal of increasing the number of college and university students who choose to join the behavioral health field. The forum featured speakers who have been successful in their education and advancement in the workforce, and it offered both student and employer perspectives. The West Virginia Forum was held at Marshall University in April 2017 and simultaneously live streamed for groups of college, community college, and even high school students around the state to watch at satellite locations, and then made available for more students to watch at a later date online. Some of the work that we did there with the Higher Education Policy Commission has led the way for additional endeavors like Stellar. In addition, we've recognized the value of trying to align multiple funders who are doing work in this space. In 2018, we had a trip around the state, and you may recognize that there are folks representing the 3 medical schools, WVU, Marshall, and the Osteopathic School of Medicine. And we work together to bring folks who are funding addiction fellowships in the medical realm and working on building the capacity of the med schools to work on interprofessional education that would benefit the workforce throughout. We also, in that same spirit of trying to build on all the resources available to us, we have joined in multiple learning collaboratives related to workforce. And I put here some examples, both regionally and nationally, National Governors Association, and then our regional SAMHSA work, whether it's related to expanding medication-assisted treatment, professional development, or with our medical schools, with social work, and also focused on behavioral health workforce in particular. There's also been a great deal of work, and this is really teeing things up for Carolyn, who will go into much more detail about this. The statewide opioid response grant had a number of opportunities that we made the most of for workforce. We were provided with opioid technical assistance and training, with this grant, again, we really focused on the service delivery infrastructure, as well as the organizational relationships to sustain systems of quality improvement, training, and our current and future workforce. And a lot of that statewide professional development was really, I just can't say enough about the collaborative spirit between WVU Marshall and the West Virginia School of Osteopathic Medicine, who are working so hard to train and provide additional training for this current and next generation of not only this as OUD providers, but also substance use disorder providers, as well as opioid use disorder. So I wanted to share a picture of some of my colleagues. This is really a team effort at the Bureau for Behavioral Health and at DHHR in general. This is us celebrating Recovery Month in September. And you'll see all the purple, that's really that color. And we were featured in some NASDAD trainings, and it's always nice to get a little shout out to the colleagues I work with who just do an amazing job and work so hard on behalf of our state. So I've suggested some questions here, and I encourage you to get in touch with me if you have interest in following up on any of the things that I mentioned. I tried to run through as much as possible in half an hour, because there really is a lot that people are working on, and to really encourage you to get involved with the efforts that are going on either statewide to bring them to your community, or if you have exciting things going on at your community, to please reach out so that we can be supportive in whatever way is possible. So thank you very much, and I'll turn the floor over to Carolyn for her good work.
Thank you so much, Rebecca. I really appreciate it. I'm going to try sharing my screen. We'll see how this goes. All right, can everybody see the PowerPoint? I think everybody's muted. How about now? Okay. So I wanted to just say thanks both to Rebecca for her partnership, and also a big thank you to Sarah and the Alliance and the Hub and Coalfield Development, because today has been a really great day. I personally have learned so much today, and I feel very honored to have this opportunity to share a little bit about higher ed's perspective on the behavioral health workforce. I think that Dr. Kelly's talk this morning that touched on stigma, and then the two panels after that, have really helped to build our knowledge about not only some of the solutions that are being used, but also how we can work together further to address these challenges in our state. So like Rebecca's talk really underscored, I think that our behavioral health workforce pipeline requires the behavioral health system, industry, and education system to work together, not just in piecemealing the programs together, not just in updating each other on our plans, but in really looking at how to truly communicate and strategically plan for a future workforce that meets the needs of our community. just not only to treat mental health and substance use disorder, but also to make sure that prevention and recovery supports are available for individuals of all ages. So I want to talk just a little bit about who we are. The Higher Education Policy Commission and Community and Technical College Systems are state agencies that are dedicated to making post-secondary education more attainable for West Virginians. So the commission works with all of the institutions at accomplishing their missions and carrying out our state procedures. There are 12 baccalaureate institutions and 9 community and technical colleges that make up these networks. And we serve more than 80,000 students through those institutions, helping strengthen access to college, supporting success, and then helping really solidify those students' impact on our state after graduation. You'll see here the little icon for West Virginia's CLIMB initiative. We are working to equip 60% of West Virginians with a certificate or degree by 2030, which will nearly double the percentage of working age residents with a credential over this next decade. So it's a large task. Our agency's behavioral health programs, which is where I work, works in connections with the Rural Health Initiative, as well as providing some leadership and partnership with some of the various behavioral health workforce initiatives in higher education, some of which Rebecca mentioned when she was speaking. We also provide support to West Virginia's colleges and universities as they work to address mental health and emotional well-being, which I think we all recognize is a huge factor right now in educational success for students is their emotional well-being and their mental health. Rebecca covered a tremendous amount of the work led by BBH and its partners to strengthen the workforce. And I'll be really wrapping up our time today by discussing some of the recent work done in higher ed to address barriers to recruiting, training, and retaining behavioral health professionals from the educational perspective. Because of time constraints, this isn't going to be a comprehensive overview of all things educational workforce pipeline, but we will highlight some of the things we've learned from students and faculty at the institutions. And I also wanted to just take a moment, because our presentation today doesn't focus directly on the peer recovery support workforce. I wanted to just acknowledge the incredible contributions of peers to the behavioral health workforce in West Virginia. They do the bulk of work really to help connect people to treatment and encourage them to stay engaged in recovery in West Virginia. And I recently heard the director of the Annapolis Coalition, which is a nonprofit behavioral health workforce think tank out of Annapolis, who he recently mentioned that the development of the peer support workforce is the most profound change that we have seen in the mental health workforce in the last 20 years, maybe even longer. And it just continues to be an incredible opportunity for growth. And it certainly is a strength in our West Virginia communities. But many jobs within behavioral health require advanced education and specialized training, and then ongoing continuing education throughout the career. And while many of jobs require master's degree, we know pay is not often not on par with professions requiring similar levels of training and education. So it's really not surprising that training and retaining providers in our state is a challenge. Higher ed efforts to build the behavioral health workforce have been in place for many years. And in the past couple of years, several higher ed institutions throughout the state have been working together to address these needs with some intersecting, complementary, and even cooperative efforts. But before we get to that, I want to talk about data just a little bit. So I'm sure that many of you on the call are familiar with health professional shortage areas. These, or HPSAs for short, are designations that indicate health provider shortages in primary, dental, or mental health care. And they're designed to help allocate the resources to the communities most in need. So it's not really a perfect measure, and it's not the only measure of access out there, but they do really help give a good picture of areas of greatest need. And as you all probably know, West Virginia has many counties that have high scores in all three areas: mental health, dental, and primary care. But the map you see on the slide is specific to mental health. And the formula to determine HPSA scores is based on the presence of independent level licensed behavioral health providers. So those are people who have attained the terminal degree in their field and then have the highest licensure level. And so you can see there on the screen, this potentially suggests that there may be some barriers to attaining that highest level. When you kind of look closely, if you can see the numbers on the screen, the higher the number in the county, the more need. And you can see that almost every county is in blue there. So that means that that is a shortage area, and many of the numbers are pretty high. So as we kind of think through data, I really think everyone probably agrees that data tracking is crucial for evaluating progress toward goals. And specific to our topic today, for measuring what programs or projects have the greatest return on investment when it comes to increasing the behavioral health workforce. So there are measures by which funding and policy decisions are made, but one fundamental concern when looking at addressing the provider shortage in West Virginia is our tracking of data. I have a lot of questions. How will we know when our efforts have moved the needle? If we're looking at an aging workforce on top of chronic shortages with the added strains caused by the state's opioid crisis and now economic and health challenges related to the pandemic, how will we accurately track both the supply and anticipate the demand? And how will we evaluate which initiatives are the best use of funds? How will we use data to address gaps consistently? The answers to all of these questions and many, many more, I'm sure, hinge on the quality, the consistency, and the analysis of data. So on the slide here, you'll see on the right side there, this is an example from the state of Nebraska, and Nebraska has been taking a comprehensive approach to the educational preparation of their workforce for at least a decade now. The article there that you see was published after their latest legislative update showed a 17% increase in behavioral health providers over the last 10 years of their work. The approaches in Nebraska range from educating K through 12 students about behavioral health careers, collaboration with their Department of Corrections, increasing paid internships and training opportunities, efforts to strengthen the cooperation between their training programs, and quite a few other strategies to increase that. But I think what's important there is seeing that they had a baseline and they were able to track by each different profession the growth in that workforce. So for us, in addition to the data that's available from Higher Education Policy Commission's Data Navigator that shows enrollment and completion, Workforce West Virginia, Department of Labor, in addition to those data sources, during the 2020 state legislature, a bill enacting the West Virginia Healthcare Workforce Sustainability Study was passed. And this directs Department of Commerce to research, survey, study, and issue a public report on the existing workforce across the healthcare continuum of care, as well as anticipated future workforce needs for the next 15 years. So that's supposed to include number of individuals employed, number of licensed people, separations, how many people are registered or certified in different professions, as well as graduates and anticipated changes in all of those numbers. So we know establishing baselines is critically important, and that report should really help be a good helpful piece of the data puzzle. Clear explanations of career pathways is also a really important piece of this, because to understand the workforce supply capability, we need to know who we can train in what disciplines and how many we can train in the state. So not really just knowing what programs exist in their capacity, but sharing that information widely so that potential students have access and the general public has access to knowing. So as we move on here, my slide may be stuck there. Okay, so building on the examples from Nebraska and other states, back in 2018, the Higher Education Policy Commission convened a work group to study the barriers to pursuing education and practice in mental health fields in West Virginia, and to map out kind of the scaffolding of an initiative to support the educational development and growth of the state's workforce. And this slide that you can see shows the focus areas of this proposed initiative. The group detailed all of this in a white paper, pulling concepts that were working well in other states that have strong programs. And it was really this work, that white paper, that led to the creation of the legislation that established the new mental health providers loan repayment program, which I'll tell you about in just a minute. As you look on the slide, you can see that the focus areas identified by this work group really run the gamut from high school all the way up through later stages in someone's career. So I want to tell you a little bit about the mental health loan repayment program, which today I'm particularly excited about because our application period opens tomorrow for this program. So if you know anyone who may qualify, make sure you pass this along. But this program was passed in 2019's special legislative session and was funded in 2020. It's designed to incentivize retention, so keeping people in their jobs in rural areas of the state particularly, or underserved areas of the state. It's for licensed professionals that are providing therapy and counseling in any of those mental health professional shortage areas that were on the map. And the program is funded at $330,000, which provides for at least 30 awards in this first cycle. And like I said, I'm very excited to tell you that it opens tomorrow. So if you want to check that out or share it with a therapist you know who still has student loans, which is most therapists probably in our state, you can head over to cfwv.com. It's College Foundation of West Virginia, cfwv.com. Also, as a result from the work that group did, we have some information that was documented in that white paper led to an opportunity for a cohort of training programs to launch pilot projects that looked at those different areas of focus that the group had come up with and tested to see with a small amount of funding what they could do. And so those projects, really, you can see on the topics on the slide here, they also kind of run the continuum. So they're looking at high school preparation, or letting people in high school know about what careers are available in this field, as well as helping people attain their highest level of credential in their field. This project both increased opportunities for cooperation between training programs and is adding to our state's evidence base for scalable programming as relates to the behavioral health field and the workforce development. Support for the projects came from the Benedum Foundation and Higher Education Policy Commission. And next up, I'm going to tell you a little bit about, here we go. Next up, I'm going to tell you a little bit about a complementary initiative that started in 2019 when the Bureau for Behavioral Health, as part of the state opioid response grant that Rebecca talked about, provided funding to the state's medical schools to provide kind of like leadership for interprofessional workforce development. And as part of this, the West Virginia School of Osteopathic Medicine convened higher ed and behavioral health stakeholders from more than 12 institutions and agencies. I know some of you are on the call today, so hello. To discuss strategies to strengthen the behavioral health workforce in response to increased need, specifically increased need related to the opioid epidemic. And their work resulted in a 3-year strategic plan to guide future efforts of various entities across the state engaging in this work toward common goals across the state. And you may have heard Dr. Nimitz mention this morning in his welcome. So I'm going to just take a few minutes to go into some of the strategic plan. I think it's important because as we're talking about solutions, many of these solutions came from experts in the field, experts in higher education, as well as ideas from students. And so the stakeholders in this collaborative formed 3 groups, and the focus was on 3 main areas: recruiting, training, and retaining. The first group, which was the Attract and Recruit group, sought to answer the key question there that you see: how do we encourage entry into the behavioral health profession? And this group's discussion was focused around areas of pipeline efforts for high school students and attracting individuals with lived experience, and then strengthening support for those in recovery, as well as looking at maybe some non-traditional recruits into the field. So looking at, were there retired people, are there veterans, are there other special interest groups that may have interest, or other special groups that may have interest in work in this field? And if so, what strategies can different entities around the state take to get the information out to those people to recruit them into the field? You'll see one of the goals here was also around strengthening collegiate recovery, as well as establishing or strengthening community networks of recovery, and just the importance of supporting our providers as they're out in the community, knowing that many of our providers are in recovery themselves. So the next work group really focused on educate and train, and their key question that guided the development of these goals was: how do we prepare our behavioral health workforce to address the challenges related to substance use disorder, both as people enter the profession and as they pursue their continuing education? And this theme has come up several times throughout the day today around stigma. But this group really identified stigma as a critically important factor to consider in the preparation of behavioral health professionals to serve those with SUD. Behavioral health professionals, we are members of the communities that we live and serve in, and so stigma has impacted us as well. And so making sure that students in behavioral health fields, as well as existing providers, have access to anti-stigma resources was a big focus of this group. So the final group that met talked about and developed the strategic plan for growing and retaining. And so this is looking at existing providers. How do we ensure that our behavioral health professionals stay in the profession, engage in professional growth, and stay in West Virginia? And I think most important here to note is that pay is a really huge issue. I don't think it's going to be a surprise to anyone to hear that that's a huge barrier. And I'm going to talk a little bit about this student survey that was conducted and the barriers that came up out of that, and kind of the key information that we learned from that study. But, you know, thinking through pay and what a challenge that is, a 3-year strategic plan isn't necessarily going to be long enough to make the changes needed, but it's definitely a start in helping different entities around the state coordinate on their discussion of these issues. So I want to talk just briefly, the members of one of those work groups conducted this survey to examine students' perceived barriers to practicing behavioral health. And the survey also explored facilitators to practice, so what's going to make it easier for them to practice. And as you'll see on the slide, the main goal of the survey was to determine students' interest and readiness to work in West Virginia, as well as to work with individuals affected by SUD. A little background on the survey: it was completed anonymously by almost a quarter of students enrolled in counseling, psychology, and social work first-year master programs back in the spring, and the majority of the respondents were from social work. Questions gathered information like high school and undergrad college major, where they participated, whether they participated in any programs during their K through 12 education that encouraged or emphasized careers in counseling. It asked about role models or other things that influenced their decision to pursue this career path. It asked if anyone had advised them not to pursue this field, and asked them about their plans after graduation, as well as what factors were most important to them when deciding where to practice. Unsurprisingly, responses regarding the greatest barriers really fell into 5 thematic categories. One was safety concerns. One was the lack of respect that others have for this career. One was low pay. One was stigma that's experienced kind of at large in the communities. And the final one was concerns about lack of resources available to assist their clients. So I'm going to go through just a few of the major findings. As we've already mentioned, concerns about pay emerged as pretty much the strongest theme from this survey. Inadequate pay was just consistently cited as a barrier to choosing the field, to practicing in West Virginia. And when the students were asked what the most concerning thing about being a behavioral health provider in West Virginia was, or what changes they would suggest, 2/3 directly cited pay, while some others referred to kind of a more general lack of resources related to working in the profession. The next major finding was really concerning stigma, and there were 2 types of stigma that students talked about. One was the stigma that is experienced in the community by people with SUD or their families, or people belonging to other groups that have stigma against them. The other area of stigma that was identified by the students was stigma kind of against the profession. So a kind of stigma toward the field of behavioral health practice. And you can see there that some of their concerns relate to, does that stigma help? Does it cause pay to stay lower? Does that stigma, how is it impacting the safety of workers in the field? A lot of concerns around stigma, and also a lot of solutions that the students presented, many of which have been integrated into that strategic plan that I just shared with you. Some other major findings here: we have very few pipeline programs for behavioral health professions. So think about STEM and what STEM has done for those professions through being integrated into K through 12 education. The students who did respond that they had access to these programs responded that yes, it did influence their decision for their career, but many did not have access to any such programs. And then also we asked about retention in the state. 2/3 plan to stay in state. Those who do not were mostly undecided. So it's a great opportunity for us to very quickly get in place the types of incentives that will keep graduates in state. Another major finding here that we've touched on just a little bit is we found that a lot of respondents had indicated that their own or family members' experience with substance use disorder impacted their decision to pursue a career in behavioral health. And so thinking through strategies to support this population and their success in the field, the students gave several suggestions, and also we heard that strong recovery supports within a community were one factor that some students consider when they think about whether they're going to practice in West Virginia or elsewhere. And so that's really a way that West Virginia's recovery communities can help lead. Also thinking through, our collegiate recovery network in the state and opportunities to establish alumni networks and strengthen supports in general for those who are graduating from programs that have collegiate recovery. Kind of in conclusion about this study, the voices of students really called for urgent attention to a coordinated plan that will help reduce some of these barriers to practicing behavioral health professions. And a couple quotes from students. Someone said more research should be done looking into these barriers. They suggested that, again, pay was really important to pay attention to. And that was the one thing that they said could make working in behavioral health better in West Virginia. You'll see there at the bottom that I think this quote really sums up. If I needed to summarize this study in one sentence, I would probably share that someone said highly trained social workers need to be able to support themselves at a level comparable to others who have earned master's degrees and continue to hone their skills with continuing education. And so we heard from a lot of students that went into the field because they felt very strongly that they were going to be helping people, they were going to be supporting people, providing the listening ear that many people needed to change their lives, but that they just want to be compensated fairly for that work. So next steps, I think I have another couple of minutes here before we close out. So next steps, drawing from the reports and the plans developed through these efforts we've just gone through, we at the West Virginia Higher Education Policy Commission and the Bureau for Behavioral Health, along with other partners, are kind of working to build on past efforts and then continue to build the behavioral health workforce. One of the things I'm excited about that's underway is a plan to provide a supportive cohort for early career behavioral health professionals who have been recipients of the 2 loan repayment programs, the one that Rebecca talked about and the one I shared about, that's ready to launch in early 2021. And that cohort will just be specific to those that are funded in those programs to help develop them as they are new professionals. Next steps are also going to include a survey of practitioners and employers to gain their perspectives on potential higher education initiatives to strengthen the workforce. And also under discussion, you'll see here on the slide, is a proposed behavioral health education and workforce initiative, which would really work to establish leadership to aid in focusing and coordinating behavioral health workforce development, including assessment, communication, pipeline programming, career incentivization, and evaluation efforts. And so you can see that around the map there, those different areas. It will require funding and it will require a lot of communication, a lot of cooperation, but I think that's what we're here for. In Small Communities, Big Solutions, is to talk about that kind of cooperation to make big changes in our state. And so it looks like we are just right on time. So I have kind of a couple of questions for you all. So those that are with us there, you can maybe just use the chat to respond to these questions. I have been thinking about this quote, community development hinges on communication. I wish I could tell you where I heard it. I don't know if I made it up. I don't think so. I tried to Google it, but I've just been thinking about it for several days. Anyway, it's been on my mind, and I've been thinking about it when it comes to what it means to be a good collaborator. And I think I heard Brandon mention in the conference welcome yesterday the idea of was it proximate leadership? Someone else mentioned it today too. And I think that's tied really closely to listening to each other and learning from each other's perspectives to strengthen our approaches to these challenges. So the first question there, how have behavioral health professionals impacted your community? And also kind of the similar question, do you think stigma against social workers is in any way linked to pay inequities? So I want to just throw those questions out to you all and invite you all to put your answer in the chat box if you have any feedback on those questions. And then with that, I thank you for your time, and I want to turn it back over to Terri.
Okay. Well, there is a question here that I wanted to ask both of you. It's from Tiffany. Do you believe telehealth will have an impact on the number of students considering a behavioral health career?
I don't know the answer to that question. I think it's a really good question. I think that, you know, thinking through the workforce of the future, we all have read and seen that the pandemic we're going through now is going to change what workplaces look like. And that flexibility is very appealing to a lot of people. And so thinking through having the opportunities to counsel or to treat patients via telehealth, maybe working from home, maybe working remotely, I would think is really going to appeal to people. Also, it is a very, it's a field that requires a lot of communication. And so sometimes it draws people who get energy from being around other people. So I think time will tell. I think it's exciting to see what telehealth is going to make possible.
Okay. Let's see, we've got a little bit of time. I'm going to ask a couple more questions here. What can small business owners and community leaders who do not work in education or health-related fields do to help support and strengthen the behavioral health workforce in their community?
Terri, can you repeat that? I'm sorry.
Yes, I can. What can small business owners and community leaders do who do not work in education or health-related fields do to help support and strengthen the behavioral health workforce in their community?
That's a great question. One of the things that I hope that more small businesses do is hire people who are in recovery and have policies to be supportive of individuals' mental health and substance use disorder needs. And there are a lot of really good examples of that, including our very own company in West Virginia. And now I'm going to blank on the name in the Northern Panhandle that, oh shoot, somebody I hope can bail me out here. But there are multiple organizations in the state that have a good history of hiring people who are in recovery. I think building on those examples is a great place to start. You know, and whether it's issues of housing or you know, who is on your board or who you know, is among your employees, those are really great places to start.
Okay. And the last question we have.
Carolyn, I'm sorry, Terri.
Oh, I'm sorry,
Carolyn,
go ahead.
Did you want to
Carolyn?
add to that?
Oh, the only thing I wanted to add to that was just thinking through, you know, what small business owners could do Host a stigma training or recovery ally training for your staff, I think, is another great piece. And I think throughout the day, there have been some, maybe some people that know about opportunities to do that. But I think just being aware of the language that we use and helping reduce stigma among the general population, most of whom probably work in small businesses in our communities, is another great way.
Okay. All right. And the last question that I can see at this point anyways is, if funding were not a limitation, how would you suggest West Virginia approach the barriers you have discussed?
I'll start on that one. I'm really good at spending money. I think establishing assessment and evaluation, coordinating of initiatives is really important. So I think making some investment in infrastructure to make sure that we're all working together would be one way. And the other top of my list would be pipeline programming for high school and undergraduate. So making sure that everyone has access to knowing what careers in behavioral health look like, and just really saturating that into our educational system.
Rebecca, do you have anything to add to that?
Just to go ahead and make the salaries higher. If I had the money tree that was unlimited, that's what I would do.
Exactly. It's a lot. The income is low and the travel is a lot and the caseload is a lot. So it does not equal. It does not equal when it comes to that. So anything else you all want to add before we close for today? I've enjoyed your conversations.
Just to say thank you, and to also note that, as Carolyn said, the peer recovery support specialist, we could spend another couple of hours talking about that field, and that there are other partners, both private and in the state, that are working on these issues. Office of Drug Control Policy, Workforce West Virginia. There are a lot of folks who are doing a lot of really good work. So I just wanted to say that, of course, this session will concentrate a lot on BBH and HEPC, but there are certainly many others who are doing important work.
And Carolyn, are you good?
Thank you so much.
All right, you all have a great afternoon. It was nice spending time. Remember that we're back at 9 o'clock tomorrow morning.